Hey guys, welcome back to my YouTube channel. Today I am here with you all to discuss about a very important topic. The topic of today's lecture is bone marrow biopsy and aspiration. So, bone marrow biopsy and aspiration, it is a medical procedure mainly used to diagnose any kind of blood related disorders. Like suppose if a person is having anemia, or if the person is having prolonged hemoglobin drop down, so to rule out the cause why the person is having low level of hemoglobin, or why the person is suffering from anemia, bone marrow biopsy and aspiration can be done. Secondly, if a person is having fever for prolonged period of time and it is not diagnosed, the main cause is not identified, so during that time also bone marrow biopsy and aspiration can be done. Then if we see, suppose a person is having leukemias, that is the blood related disorders, or lymphomas, that is if the cancer is affecting the lymphatic system, then also we can do bone marrow biopsy and aspiration. Okay, then again, if the person is having prolonged infections, to rule out the cause why that person is having infection, whether all the levels of WBC, platelet or RBC production it is occurring properly or not, then also we can do bone marrow biopsy and aspiration. So without wasting much time, let us start with our topic. I hope this video will be helpful for you all, and if you have any doubt regarding this topic, you can comment down me later in the comment section. Okay, so without wasting much time, let us go to the topic. So firstly, the definition of bone marrow biopsy. So it refers to assessing and obtaining a sample of bone marrow that is aspirated from the bone marrow sites. So most commonly used areas or the sites for bone marrow biopsy and aspiration. In case of children, tibia. Then in case of adult, already I have mentioned ilium. Okay, sternum. In case of children, it is mostly preferable, and obviously it is a aseptic technique where we need special biopsy needle to collect the bone marrow sample. Okay, then the purpose of bone marrow biopsy. So firstly, to diagnose any kind of blood related disorders. So already I have mentioned that to rule out the anemia, then to diagnose lymphoma, then leukemia, this bone marrow biopsy and aspiration can be done. Then to assess the bone marrow functions, like whether the bone marrow is working properly or not, whether the bone marrow is able to produce the cells like RBC, then platelets, WBC, whether all the function is having properly or not. To assess that functions also bone marrow biopsy or aspiration can be done. Then thirdly, to rule out any kind of infections. Suppose it is not able to diagnose, or the proper cause of the disease is not ruled out for a prolonged period of time, so during that time also this bone marrow biopsy can be done. Then again, to confirm the cancer spreading as well as the staging. So in certain cases, if the stage, to confirm the spread of that particular disease, this bone marrow biopsy can be done. Then again, to monitor the treatment response, like whether suppose a person is diagnosed with a cancer like leukemia, whether the chemotherapy given to that person is working properly, or whether that chemotherapy is working effectively or not. To rule out all these functions, this bone marrow biopsy can also be done. Then again, suppose a person is having fever for a prolonged period of time and the cause of the fever is not known, so during that time also bone marrow biopsy can be done. Then to monitor the treatment response in case of chemotherapy. Then to investigate the low or high blood cell count, like thrombocytopenia, that is the low platelet count, or leukocytes. All these things can be diagnosed easily. Leukopenia, that is all level of the blood cell counts are becoming low. Now let us discuss about the contraindications of bone marrow biopsy and aspiration. So if the person is already having an infection, so for that person will not do bone marrow biopsy and aspiration in that particular site, because that infection can further lead to septicemia if we'll do puncture in that particular site. So another infection we can take the example of osteomyelitis disease conditions. So for those patients will not do bone marrow biopsy and aspiration. Then let us discuss about the sites for taking bone marrow biopsy. So already I have mentioned some sites, so can you name some sites, or you can comment down in the comment section below. So some common sites like posterior superior iliac spine, posterior superior iliac crest is the most commonly used, and it is very preferable in case of adult as well as children. And if the due to some certain conditions, or if the person is having injury in that particular site or previous infection in that site, then third preferable site will be anterior superior iliac crest. And if these both of the sites are not accurate or it is not feasible, then we'll go for the sternum. So basically for bone marrow aspiration we can take the site from sternum, but there can be some further complications or there can be some injury if we take the sample from the sternum, because nearest to the sternum there are medicinal organs which can be affected, or there can be injury to those organs. So these are all about the sites for collecting the sample. Now let us discuss about the articles required for bone marrow biopsy. So a sterile tray, it should contain the bone puncher needle with obturator. So basically for bone marrow biopsy we used to take the Zamsedi needle, and for the aspiration we used to take the Klima needle. Other articles like BP handle we used to take with blade so that we can make a small incision if necessary. Then we need lignocaine 2%, that is local anesthetic, so that we can numb the biopsy site and we can minimize the pain in the person. Then we need personal protective equipment in order to maintain the aseptic technique: sterile gloves, gown, masks, cap. Okay, all we need to in order to maintain the aseptic technique. Then a heparinized vial, or we can take EDTA vial, or we can take formalin fixed container, so that we can collect the samples and we can send the samples for histopathology and flow cytometry. Then aspiration syringe is compulsory so that we can draw the marrow sample for examination. Then sponge holding forceps we need so that we can hold the sterile sponges during the procedure, we can hold the sterile items. Okay, then dissecting forceps we need so that we can handle all the sterile items and tissues. Then small bowel so that we can take the antiseptic solutions or anesthetic agents. Then dressing towel so that we can maintain a sterile field during the procedures. Then cotton swabs and gauze piece, so it is used for cleaning and maintaining the hemostasis after the procedures. Then we need kidney tray as well as paper bag so that we can discard the liquid as well as the solid waste. Then we need spirit and iodine solution, that these are antiseptic agents that are used for skin disinfections before the procedures. Then obviously we need Macintosh and towels so that we can protect the patient's clothing and provide a clean working surface for the patients. Then again we need adhesive tape and scissors, so that is used for securing the dressings after the procedures. So these are all about some articles. Now coming for the procedure, so at first we'll gather all the necessary required articles that are sterile. We need to prepare 2 tray, one for the sterile articles and other for the clean articles. Then we need to verify the patient identity. This is the very most important step, and we have to explain the entire procedure to the patient, that this procedure will last for 10 to 20 minutes, and then we'll take consent from the patient. Also we'll explain the sites, the purpose of doing this procedure, both to the patient as well as the attendant. Okay, then we'll provide the patient a proper positioning. So for the sample collection, if we will take the sample from the sternum, or suppose we'll take the sample for from the posterior superior iliac spine. So in case of sternum biopsy, we'll ask the patient to be in a supine position, and for the iliac crest biopsy, we'll keep the patient in a side lying position. Then we'll place the Macintosh and towel under the biopsy site. So we'll be understanding this procedure after the explanation. I'll be showing one video, so it will be more clear after that. Then skin preparation and anesthesia. So cleaning the area with spirit at first, then povidone iodine in a circular motion. Then we'll allow the site to dry and apply the sterile drops around the area. Then we'll administer 2% lignocaine in order to numb that particular area and underlying tissues. Then we'll do the incision and bone access. So how we'll do that? So by using a scalpel with BP handle, so that we can make a small incision. Firstly, we need to identify the sites, and after confirming the sites, cleaning and all, with the by doing the area, by disinfecting the area, we will do incision in that particular site with the help of the bone marrow biopsy aspiration or biopsy needle. And in case of tissue collection, the most commonly used needle is a Zamsiti needle. It is having an obturator, and after doing the biopsy, we'll do the aspiration. Then we'll attach the syringe to the needle and aspirate bone marrow for the cytological examination. And if there is no any aspirations, then we'll proceed directly to the core biopsy. Then core biopsy. So for core biopsy, we need to remove the obturator and advance the biopsy needle deeper using a gentle rotating motions. So we have to move clockwise and anti-clockwise in a rotatory motion, and until we feel the hardness, basically in the cortex, until we feel the cortex area. So once sufficient core tissue is obtained, we'll rotate and withdraw the needle carefully. Then we'll collect the sample into a container for further processing, and if necessary, we'll prepare the samples immediately for microscopic examination. Then the most important thing after the procedure is post-procedure care. So while doing the procedure, we'll maintain the aseptic technique, right? So after the procedure also, we'll apply a film pressure with sterile cotton swabs and gauze, so that it will stop the bleeding. Okay, then we'll close the incision with the help of adhesive tape, and we'll cover the area with a sterile dressing, and we'll advise the patient not to remove that dressing for 24 to 48 hours. Okay, because, and we have to explain the patients also that why this removing is not required within 24 to 48 hours, because there may be chance that the patient may bleed from that area, because already the patient is immunocompromised, or you can say already if some patients are having low platelet count, then there can be chance that there will be hemorrhage from that particular site. Then again, we have to monitor the patient for pain, any signs of complications. So signs of pain like redness, warmth. Okay, then we'll have to keep the patient in supine or lateral position after the procedure. Then we have to administer analgesic if required. Then we need to monitor the vital signs or blood pressure in every half an hour for 4 to 6 hours until the patients become stable. Then if we see the complications, so the patients may have bleeding in that particular site if the patient is having thrombocytopenia, that is the low platelet count. Then secondly, infections. So particularly in the biopsy site, there since the patient is already immunocompromised, so there can be infections. Then obviously it is a very painful procedure, so patient will feel discomfort and pain in that particular site. So these are some complications. So again, some complications like hematoma may occur if proper hemostasis is not maintained, or if proper pressuring the area after the procedure is not done. Okay, so these are some complications. Now if we see about the bone marrow aspiration, so it is also an medical procedure where the physicians, they used to take out a small amount of liquid bone marrow by using a needle, often from the hip bone. The sites are similar only, and after taking out the sample, they will collect the sample under a microscope or in a slide or in the container, especially in the heparin file for the flow cytometry. Okay, and they will assess the blood cell production and identify any kind of abnormalities. So indications are also same, like in order to diagnose hematological disorders or in order to monitor the anemia. Okay, if in order to check the blood count and all. So the indications are same only for staging the malignancies also in case of Hodgkin and non-Hodgkin lymphoma, and if the patient is having prolonged fever and if it is not cured and if the cause is not identified. So for those patients also we can do bone marrow aspiration. Again, in certain cases like granulomatous disease also the bone marrow aspiration can be done. So contraindications, similarly, whenever the person is having any kind of infections, history or septicemia, we will not do this bone marrow biopsy and aspiration. Then in order to understand this procedure in a brief way, I will be showing one video, so you can go through the video.
Bone marrow biopsy is often done following a bone marrow aspiration. Maintaining sterility, obtain a bone marrow biopsy needle. Holding the needle between your palm and index finger, insert the needle into the patient's skin and advance until it touches bone. If an aspirate has been performed, the same entry site through the skin may be used for the biopsy. However, a skin incision may be indicated if only a bone marrow biopsy is being done, or after an aspirate to allow for entry of the larger biopsy needle. While applying steady pressure, advance the needle with its stylet in place into the cortex by rotating back and forth. The biopsy needle should be inserted into bone at a slightly different angle than a previously performed aspiration. Once the needle is anchored in bone, remove the stylet. Continue to advance the needle 1 to 2 centimeters into the marrow cavity with a back and forth rotating motion. The stylet may be reinserted to determine the length of the biopsy specimen in the needle. In order to remove the biopsy specimen, it must be detached from the surrounding marrow and bone. Do not pull the needle straight out, as doing so may allow the specimen to remain attached to surrounding marrow and prevent it from being removed in the needle. Rotate the needle 360 degrees several times in both clockwise and counterclockwise directions prior to removal. The needle should then be rocked back and forth to ensure detachment of the specimen from surrounding marrow. Slowly pull the needle by inserting a sterile probe into the distal end of the needle and push the specimen. Check the specimen for adequacy of marrow. Apply pressure to the biopsy site with gauze until any bleeding stops, and cover with a bandage or pressure dressing. Instruct the patient that the dressing can be removed the next day, and that they should protect.
This was all about a very short video regarding the bone marrow biopsy and aspiration. I hope it is clear for you all guys. So today we'll have covered up all this topic about the definition of bone marrow biopsy and aspiration, and the indication, purposes, contraindications, and at last we all have learned about the procedure. So I hope this video is helpful for you all. If you have any doubts regarding this topic, you can comment down in the comment section below. At first I was having some network glitch, due to that I was unable to focus properly on the video.
You prepare.
We'll have learned about the complications, then the post-procedure care. So at last we'll conclude the topic that bone marrow biopsy and aspiration both are medical procedures that are done by the physician in order to rule out any kind of blood related disorders. Either it can be cancerous or non-cancerous. Cancerous, like it is helpful to diagnose leukemias, that is the blood cancer. Then hematological other disorders like lymphatic disorders also, like Hodgkin and non-Hodgkin lymphoma. If the person fever is not known, or the cause of the fever is not diagnosed for prolonged period of time, then also we can do bone marrow biopsy and aspiration. For ruling out the cell count, we can do bone marrow aspiration. Okay, now if we see or remember the sites, so different sites are there: posterior superior iliac spine, and in case of children, sternum, from sternum also the aspiration can be done. Then other sites like tibia. Okay, so these are all sites, and it should be kept in mind that while where as per the sites will give positioning to the patients. And it is a aseptic technique we should keep in mind. So proper sterile technique should be maintained while doing the procedure. And after the care also, we should advise the patients not to remove the bandage, and we need to ask the patient to hold the area at least 10 minutes, and ask the patient to remain in supine position if the sample has been taken out from the posterior superior iliac spine or inferior superior iliac spine. Okay, again, the most important thing we need to advise: avoid strenuous activity, or avoid bathing, or wetting that particular area or that site from where the sample has been taken, because again the patient may develop infection from that particular site. Again, the sign of infections should be observed, vital signs should be monitored frequently, being a nurse. So I hope this will help you all. So thank you for watching this video, and if you have any doubts, you can comment down in the comment section below, and any topics you further require, I can provide some slides related to the medical surgical nursing. So till then, take care, and thank you once again.